What I'd like to discuss with you very briefly today is the interest that I have, as well as our research group, regarding heart failure and the remodeling that occurs with it. What we mean by remodeling is the heart changes shape and size as it tries to continue to function normally. Unfortunately, when the heart gets to be enlarged, it is working in a very inefficient way. And what we like to do is understand the underlying pathways and mechanisms by which the heart enlarges or remodels. One of the things that we have now recognized in the past decade is it's not just the cardiac cells that make up the myocardium that remodel, but the matrix that holds those cells together changes shape and size. And it's this matrix remodeling that we believe holds the key to not only new diagnostic therapies, but also to new treatment modalities. And we're pretty excited about the idea that we have some new blood tests that we think we can use to identify patients early during the structural remodeling of the matrix as the heart fails. But also we now are starting to develop some novel drug therapies that we believe will be very beneficial for patients in heart failure and this continuous remodeling process. And the part that is really concerning to us is to be able to identify those patients very early in the process when their heart changes shape and function, hopefully before they develop severe symptoms of heart failure. That would require some sort of a diagnostic test. And for us to perform that diagnostic test, it needs to be something simple and reproducible that a physician could perform in their office. And for that, we have led ourselves to develop blood tests where we could take a simple blood sample from a vein, a peripheral vein that most every physician can do in their office, and then hopefully be able to take that blood sample and measure proteins or things that would indicate that the heart is changing shape and remodeling, which would then give an early warning system to that physician that something is structurally changing within that patient despite adequate management and therapy. And that would be, for example, we would measure unique proteins that have been discovered recently called the matrix metalloproteinases, big word, abbreviated MMPs. And we have now identified that a unique blood signature of these MMPs occurs in patients late after their heart attack or late after they've had long-standing hypertension, or maybe from other causes that would progress to heart failure. And we believe that we'll be able to have very soon blood tests that will give you a unique signature for that patient that is developing early heart failure due to either a myocardial infarction or to long-standing high blood pressure.